This skill is performing catheter care on a patient. I'm going to start. Knock, knock, knock. Hi, Miss Jones. My name is Jennifer, your CNA today. I need to do catheter care on you. I'm going to wash my hands and get my supplies. Washing my hands. The supplies I need are bath blanket, towel, 2 washcloths, and a disposable pad. You can choose to use paper towels as a barrier, or you can get one of these disposable pads. I just choose to use paper towels so I don't waste my disposable pads, but do whatever you need to do for your test. I need soap. I need a basin. And I need gloves. Whenever you're doing a skill that requires water, you have to make sure that you allow your patient to test the temperature of the water. I also, before I put my gloves on, I would close my curtain, but for videoing purposes, I'm not closing the curtain right now. Whenever you're doing a water skill, I tell my students, do not multitask. Get your basin, set it down, and then you're going to use your paper towel barrier to test the temperature of your water, adjust the temperature of your water as you need to with your paper towel and throw it away. And then use 2 hands to put your basin under the sink, under the water. If your basin taps the sink, you need to make sure that you make a correction that I wouldn't allow the basin to touch the sink. Turn your water off. I like to use paper towel. Miss Jones, I'm going to take your call light. Put the paper towel under her hand so that she can test the temperature of the water. Is that a comfortable temperature for you? Great. Dry your hand. Okay, so first I'm going to put a bath blanket on you to keep you warm and give you a little bit of privacy while we're doing this skill. Whenever you are opening any kind of linen over your patient, do it directly on top of your patient. Don't hold it up above the bed and open everything up. I'm going to pull the sheet down. And I like to just pull the sheet down just to cover the feet. And you need to pull the patient gown up because this skill requires you to keep the linens dry and the gown and everything dry. That wouldn't have been there. Okay, Miss Jones, I'm going to offer you a preference. Would you prefer to lift your hips for me to get this pad under you, or would you rather turn on your side? Okay, you want to turn on your side? So first I'm going to cross your legs under the sheet. I'm going to cross this arm. And on the count of 3, I'm going to turn on your side. Ready? 1, 2, 3. You're not too close to the edge of the bed. And I'm putting this pad underneath her buttocks and her thighs so we keep the bed dry. I'm going to turn back. Ready? 1, 2, 3. You're not too close to the edge of the bed there. I'm going to uncross your legs. For this, when you're doing this skill, we're lifting the blanket up from the bottom, not from the top. Whenever you're using a water skill, I like to do this with my gloves to make sure that they're not drippy everywhere so I don't get everything wet. Once you put soap on your washcloth, don't dunk it in the water and to get it all soapy and sudsy. The evaluators can see that you're already putting soap on your washcloth. Okay, I'm going to uncover you. So first I'm going to wash one side. Go from the top of the labia down to the bottom. Make sure you get the perineum. change the side of your washcloth. Go from the top down to the bottom. Now I'm going to do the center, top, all the way down the perineum. And now, in making sure you're changing the spot on your washcloth, I'm going to do the catheter. So I'm going to squiggle it just a little bit. Make sure you hold it in place. You're going to clean down the shaft of the catheter. Set that on my side. Don't ever leave your washcloth in the water. You do the same motions for rinsing. I'm going to rinse you now. I'm going to uncover you. Do one side, containing your washcloth. Don't do the other side. Go down the middle. Now I'm going to clean your catheter. Make sure I hold on to it. Set that on the edge of my basin. Now I'm going to dry you. Now your towel is big, so obviously you're not going to hold the whole thing in the hands. I'm going to cover you. I'm going to dry this side. Just make sure you change the spot on your towel with each drying stroke. Going down the middle. Don't go like this, lift your towel up, and then go back down, because that means that you're using the same spot for two different movements. Just if you need to, you can hold the catheter up so that you can go down the center, down the perineum. And you still have to clean or dry the catheter. Cover my patient. I'm going to get rid of my linens now so I don't have to leave them on a tabletop. There's my laundry basket. Pretend right there. I'm going to pull your gown down, Miss Jones. Okay, I need to take that pad out from underneath you. Would you still prefer to roll on your side or lift your hips? If the evaluator says, oh, lift my hips, then all you have to do is say, okay, we're going to bend your knees, Miss Jones. And on the count of 3, we're going to lift up your hips. So you're going to just slide your hand underneath your mannequin. On the count of 3, ready? 1, 2, 3, lift the hips, pull the pad out, throw that away. And then you help them gently straighten their legs again. Pull the blanket up, or the sheet up. Pull the bath blanket out. Make sure you roll it up. Get rid of it. Fix the sheet. Check the catheter tubing for kinks since you were just all up on her catheter. Now I'm going to get rid of my water. Make sure your water, anything from the waist down, you're going to put into the toilet. Make sure that when you're dumping your water in the toilet, that you've got your basin far enough above it so that they don't think you're resting it or tapping it on the toilet edge. All you have to do is just put a little bit of water in your basin. You don't have to swish it around underneath the sink, because then you're going to end up hitting the basin on your sink. You can swish around here if you need to. Don't spend a lot of time swishing it around, because this is a simulation. It's not real perineal junk that you're cleaning. But you do have to make sure that all of your equipment is dry before you put it away. I like to use a barrier since I've had my hands all in her stuff. That's all dry. Close my toilet lid. Take my gloves off properly. Wash my hands as soon as I take my gloves off. Ms. Jones, here's your call light. Don't feel like you have to handle your mannequin's hand, just making sure that you're addressing the call light and you're putting it within their reach. At this point, I would have a paper towel barrier to open up my curtain. Ms. Jones, you're not too close to the edge of the bed since we've turned you a couple of times. Would you prefer a magazine or a newspaper? Magazine? Great. You want your TV on or off? Okay. All right, so any corrections that I might need to make is I gave her a preference on whether she'd like to roll on her side or lift up her hips when I placed the pad underneath her. I closed the curtain before I started my skill and I opened it when I was done doing patient care. I offered her a paper towel. She got to test the temperature of the water before I started doing care. I did not raise the level of the bed, so I don't have to worry about lowering it. I checked the tubing for kinks, and I'm done.